hello, and welcome to all of our viewers around the world. I'm Fiona Lang Sharp, IBCLC Director of Communications and MC here at Gold Learning. Welcome, everyone. Again, we're back talking about what's coming up here at Gold Learning, and we're talking about our Gold Tongue Tie Conference. That's right, it's over on goldtonguetie.com. You can find all the details of all the things that are coming up here at the conference. We've got open access keynotes, which you can register for today. They are open access and free. That's right. I know that's what you wanted to hear. What that means is you can come and join us, listen in to some fantastic content. But if you were planning on coming to the conference already, you know this is the time to get registered and get in on all of the opportunities that are going to be here as part of the conference. Now, we have some fabulous presentations coming up, but one of my favorites, definitely with you, Leslie, I have to say, welcome back to Gold. It is so good to have you here. Leslie Kowalski is here with us today. Thank you for joining us, talking about getting feeding back on track after tongue tie release. Welcome, Leslie. It's great to have you here today.
Thank you. It's great to be here, and I'm honored to be speaking again with Gold.
Now I'm gonna put you in the hot seat just for a minute. I didn't tell Leslie I was gonna do this, but I am
Uh-oh.
gonna put you in the hot seat because I'm gonna tell people that you're having a hard time with the information that you actually want to give because it's just you're just so excited about the topic. We've been talking about this for a while. What am I going to actually share? I've got so much content, but that just lends to the fact that you're so passionate about this topic, Leslie. Honestly, I can just see it. I know that we could do a weekend, talk on all of this together. It's just fabulous. But tell me, in that passion and in that discerning and all the things that you want to be able to teach on, what has struck you as something that that's really your driver? Like what, why is it that you're so driven to share on this topic?
When it comes to tongue tie, it's such a complex scenario. You have the parent, you have the baby, they have their unique anatomy and physiology, their emotions about it, and it's a lot to manage. And
Right.
sometimes as an IBCLC, I might be the first person to tell a family that their baby has some kind of uh an issue that
Right.
they have to, and then of course it's very stressful for them.
Yeah.
So it's complicated dance because there is a lot of information that I want my patients to have. I want them to
Hmm.
feel empowered and educated so that they can make decisions. But it's also very overwhelming, and so and I tend to be an information overload sort of gal. So I'm always trying to reel myself back, not just doing this talk, but also even
Yeah.
with my own patients. So um uh
I
so when
love
I you
that.
know so when I'm working with people, I really want them to feel prepared.
Sure.
And with the topic being how do you help family post pornotomy, that really starts pre-pornotomy, that we want
Yeah.
the family to be prepared for what's happening so that they can make choices for their baby's care.
Yeah, absolutely. And I know that, at the heart of things of you, as I've gotten to know you over the last few years, you are a researcher at heart. I'm going to tell people right now that, you have your PhD in biochemistry and molecular biology. This is where your beginnings were. And look at what you're doing today, and I think that's what excites me about your presentation is that you really push the boundaries when it comes to education, and it's not about, oh my gosh, I don't know what to give them. It's just deciphering, with all the research that we do have, all the clinical anecdotal research that we have, and the information overload that we're on. What is going to be important? How do we decide, on the information? And sometimes with the so many unique cases, I find, Leslie, how do we practically say, oh my gosh, here we are. This is another unique case in tongue tie. How could this, how can this be? But that's what seems to be coming up right now. A lot of very unique cases.
Yes.
No restriction in the mouth is the same,
Mhm.
when it comes to And some things are working and some things are not, right?
Yes, yes. And it's I know, and I think as a field, the research among the field, I think the whole goal is to come to some consensus, but it's exceedingly hard to do that because there are such variations.
Right.
I think an old adage used to be, saying that someone is a little bit tied is like saying that they're a little bit pregnant. And I I I get that there can be, a restriction and we can call it a tie, but the way that it impacts that particular baby, that particular family, the variations are very wide. And
Yeah.
so how we approach it is there are as many solutions as there are families, you know?
Yeah.
So, yeah.
Yeah. Yeah, it's a lot, and I can
Yeah,
see and now I can understand even in this moment, how to bring this all together so that we have something to work from. But this is clearly like your energy and your background in research and the work that you're doing today, I think is really giving us an opportunity to even put our critical thinking hats on and go, okay, now this is the beginning. Now we've got to take it to a whole new level. That's every time I'm with you, that's exactly how I feel is that you push the boundaries in terms of, okay, that's fine, Fiona, you're doing this, but what about all these other things, that could happen and or are happening in, as they're being presented to us. So, and again, not always research based, but, happening in front of us as a clinician, which is
absolutely. Yeah.
yeah, which is really valuable when you look at the big picture as well. After so many years, working in the field, I know you have a background as well in community support with Leshy League and so forth and so on. I want to pose this question to you because this has been coming up with some of our other presenters in talking about how some people, some folks are maybe still doing the same things in the field of lactation from 10 years ago. Are they still valuable? Should we all be changing? Like what is the answer here in terms of, of progress? Because I feel like my practices, I'm not even doing the same as I did 5 years ago, you
No,
know?
same.
So the
Same for me.
fact that,
Yeah.
yeah, the fact that
Yeah.
people are doing things 10 years old,
Mhm.
some things still work, but do they really? Where is the progression there?
That, especially within the tongue tie field, I think that can be really problematic and
Mhm.
tricky to balance because um, the way that we approach um the progression of events, so we see a baby that's tied and how do we approach that? I think once upon a time people used to say, "Oh, there's a tie, just go release that."
Right.
And the most modern approach is to say, "No, we really have to prepare this baby. We have to prepare the family, you know, um, and I think it can while yes, some babies can have a tongue tie release with very little prep and do okay, or
Right.
even do well, I think the chances of it not going well are much higher. So if someone is using that old information, that is going to be a problem.
Yeah.
That being said, there are varying levels of lactation care from community support through to the clinical level, and all of those levels have value.
Sure.
Absolutely.
Yeah.
But it's certainly my goal is always to stay as evidence-based as I can to keep up with the research. But also, no, I think, what you said before, that it's sometimes there isn't research for what we're doing, but we're seeing it on a daily basis. And, how do we communicate that with our patients and how do we communicate that with our colleagues so
Right.
that we all continue to further the cause together?
Yeah, absolutely. Well, one of the things that I love is that, the responsibility does lie with us. So even when we have the research or not, we have to come together as clinicians. So we're going to do that at the tongue tie conference, which is fabulous because I thought, okay, well, there's one solution. We've been doing this for a while here at Gold Learning, but having this conference is about taking responsibility for ourselves and as a global community as well. And it's just going to be absolutely fantastic to have you participate in that. Just, I'm excited to hear what you have to share with the audience. And from your viewpoint, from your background, that really solidifies a lot of, dissemination of, research and, when we have it, when we don't have it, and how we sort of move through each of those components, especially when we're working with families, getting feeding back on track after tongue tie release with Leslie. Thank you so much. It's been so lovely having you here today, Leslie, and I'm
Thank you.
super excited to sit down with you again during our live presentations here at Gold Tongue Tie. So for everyone listening in, Leslie will tell them how to get there once again. So goldtonguetie.com. You can head over there now and get all the details of what's coming up here at the conference. We're excited to have Leslie. Leslie, you'll be here for a live Q&A as well, interacting with the audience, lots of videos to show you. I think that's what people really love about this event as well, is that so many of our presenters have fabulous clinical videos to show you really how to work through some of these very important opportunities with families. So thank you again for being here, Leslie. We'll talk
Thank
to you
you.
really soon. Yeah. And thank you to everyone listening in. Don't forget to join us. We're looking forward to seeing you online, of course. Thank you for being here and have a wonderful rest of your day. Bye bye for now, everyone.